I'm Kai Ackerman, and this is the Neuropharmacology of Drugs project. To begin, synaptic transmission is when a neuron transmits a nerve impulse to another neuron or to a cell across the synapse through chemical signaling of molecules called neurotransmitters. The presynaptic neuron releases neurotransmitters packed into small vesicles into the synaptic cleft. The neuron that receives the signal is called the postsynaptic neuron. The neurotransmitters from the presynaptic neuron attaches to a receptor on the surface of the postsynaptic neuron. Neurotransmitter molecules are then taken back into the presynaptic neuron so it can be recycled, or enzymes break them down and use the parts to make more neurotransmitters. Target sites are the specific location on the postsynaptic neuron that respond to chemical signals. There are 4 ways a drug can affect a synapse. Agonist action is when a drug binds to a receptor and causes a biological response, increasing the effect of the neurotransmitter. Antagonist action is when a drug binds the receptor but does not activate the receptor and interferes with the ability for agonists to bind to the receptor. Blocking reuptake is when drugs prevent neurotransmitters from being reuptaken into the presynaptic neuron. This leads to a high concentration of neurotransmitters in the synapse. Inhibiting enzyme degradation is when enzyme inhibitors prevent enzymes from breaking down neurotransmitters, leading to high concentrations of neurotransmitters in the synapse. For the mechanism and effects of Prozac, Prozac is a selective serotonin reuptake inhibitor, or an SSRI. For the mechanism, serotonin or Prozac primarily works by increasing the amount of the neurotransmitter serotonin in the brain. It also blocks the reabsorption of serotonin, leading to more being available in the brain. High levels of serotonin for use correlates with good moods. In normal serotonin transmission, it moves from the presynaptic neuron vesicles into the synapse, then temporarily binds to the serotonin receptor called 5-HT. These are G protein coupled receptors or ligand-gated ion channels. Excess serotonin is either diffused or reuptaken through the serotonin reuptake transport protein on the presynaptic neuron. With Prozac, it binds to the presynaptic reuptake protein. Then, the protein's gating mechanism is disabled and is no longer able to transport serotonin. This is shown in detail down below. These diagrams represent the normal serotonin transporter proteins and the inhibited transporter proteins through Prozac. As you can see, serotonin is not able to be reuptaken into the cell. For physiological effects of Prozac, one is that the brain adapts to increased serotonin by the changes in the concentrations of neurotransmitters. This can lead to emotional numbness, as the capacity to experience negative emotions is stunted. The brain can get used to Prozac and be used to feeling okay and happy all the time. Prozac can also lead to increased anxiety due to the drug's activity at serotonin receptors can lead to fight or fight responses. As much as I'd love to kill you, I'm glad she's born. Another side effect can be brain fog and trouble with focusing, memory, and concentration. Some psychological effects can include improved mood stability. Prozac can help people with depression gain positive, happy feelings and help their moods become more stable. Moods can be regulated, but they can also suffer if serotonin levels become too low. Another effect of Prozac is improved sleep, as poor sleep is often a symptom of depression. For the therapeutic uses of Prozac, Prozac can be described by professionals to treat depressive disorders and also to alleviate concerning symptoms of sadness and lack of motivation. Prozac can also be used to treat OCD and prevent intrusive thoughts. Other uses of Prozac can also include treating bipolar disorder, panic disorder, and generalized anxiety disorder. There are also some harmful uses of Prozac, including addiction and psychological dependence. People can become too dependent and feel like they need the drug to live. Some can misuse Prozac to cope with issues like stress and sleep problems without an official diagnosis. When the brain and body get into a state of adaptation to a drug, the nervous system creates a new state of equilibrium, or homeostasis. So when a drug use is stopped, there's a biological imbalance that the body tries to balance through withdrawals. Withdrawals from Prozac can include symptoms such as dizziness, insomnia, anxiety, mood swings, and nausea. Symptoms can vary from mild to severe and are dependent upon the duration and intensity of dependence on the drug. In conclusion, Prozac is a selective serotonin reuptake inhibitor, a drug that specifically affects neurotransmitters in the central nervous system. It blocks the reuptake of serotonin. It increases serotonin levels in the brain and helps improve mood and reduce symptoms of depression. This highlights the diversity of drug action on the CNS and how different drugs can either enhance, block, or mimic neurotransmitter activity. The use of Prozac raises ethical questions about the responsibility of prescribing psychiatric medication. It can greatly improve the quality of life for many, but there are many concerns about overprescription and dependency, along with the side effects. It also brings up the importance of combining medication with therapy and social support, rather than relying only on drugs. Ethically, treatment should focus on the long-term recovery and the well-being of patients. Thank you.